The digital front door, new blueprint, healthcare's new blueprint. How will today's healthcare companions build deeper, lasting relationships with their in-demand customers in 2020 and beyond? I'm thrilled to welcome our next speakers to the stage. You can join me. And I'd like to introduce you to Mike Feibus, a leading industry analyst and influencer who will be leading this discussion. Thank you.
And I'll let them each introduce themselves. Why don't we start with Nancy?
Okay, thank you. I did the same thing in New York, so I'm laughing at your story. So I'm the CEO of a health system that's headquartered in Virginia. We have 7 hospitals. We have a large physician group of about 1,000 providers and another 1,000 who also are in private practice and practice in our hospitals. We cover about a third of Virginia and parts of West Virginia in urban, suburban, and very rural service area for about 1 million people. We have, about 10 years ago, partnered with Virginia Tech and created a new allopathic medical school and a biomedical research institute, which have been enormously successful. And more recently partnered with another state university to create a large nursing school and education at the bachelor's, master's, and doctoral level for health careers. So we're really embracing young learners and trying to deliver care in new ways.
I'm Anjali Kataria. I'm the CEO and co-founder of Mytonomy. This is my 3rd startup in the enterprise software space. Prior to this, I was VP of product strategy at Oracle, where I worked with large pharma in PLM, product lifecycle management. My second company was a product lifecycle management and ended up getting acquired by Oracle. And prior to that, I had a recipe management company in the wine and beer space, doing tasting and recipe management for winemakers. I joined the Obama administration and moved to DC, and I found myself there in an innovation role over at the FDA, and it led an innovation lab with many startups and was also at EOP. During the entry days of my time joining EOP, and the Obama administration, I found myself flying back and forth between Washington, D.C. and Durham, North Carolina. I had suddenly become a caregiver. My mother, who is a pediatrician, and my father, who is a lung specialist, were at Duke Hospital camped out because my mother had been admitted. And it was unexpected, as many of you probably, how many of you have become a caregiver to your parent or child unexpectedly? Right. And I suddenly got dropped into healthcare, and it was eye-opening. Being a Duke and Harvard-educated woman, I found myself completely on my knees and trying to find out, information late at night, logging on, Googling information at 11 o'clock at night, watching videos, trying to keep up, trying to find the doctor at the cafeteria or to time it when he was going to be there for rounds, and trying to keep up with my young children in DC and my family, trying to keep our family abreast of what was happening as fast as it was happening, trying to understand the choices in front of us. And it was eye-opening how fragmented and how compartmentalized and just how much opportunity there is for digital transformation in healthcare. And so when I left the Obama administration and joined Mytonomy, I found a technology platform that I thought could really make a difference, and I've committed this next phase of my life to that.
So, Anjali, let me ask you then, when I think of the digital front door, I think of filling out forms and making appointments, which is all well and good as far as it goes, but I sense that your vision goes well beyond that, yes?
It does. I think digital front door probably did start out around online appointments, but I see it as a much broader enterprise strategy to help healthcare systems bring together multiple technologies. Mytonomy is only one technology that is in a digital front door strategy. So if we just take a step back and think about the world as it is in healthcare, we have this environment today where we have these new entrants. We have pressures from consumer tech. We have large tech coming into healthcare. We have retailers coming in that are creating unprecedented opportunity for health systems to make changes. These are catalytic times. And the digital front door is a response. It's an opportunity for healthcare systems to bring the trusted relationship that they already have with patients. When you think about who a patient trusts the most today, it's their doctor, it's their nurse, it's their care team at their hospital. And consumers are looking at where should they go for care. They're trying to find that right doctor, that right nurse who will become that trusted person in their life for a very long time. And that digital front door is that strategy to maintain those patient encounters over that patient journey, and it requires multiple technologies. It's not just online appointments, it is online appointments, it is online forms, because that provides convenience and access, bringing in consumer-like behaviors from outside of healthcare into healthcare, but it's also things like expectation setting and online look-up learning, which we all do. When we think about how we learn things nowadays, we all go online. Video is a big piece of that. Whether it's entertaining from TikTok to YouTube to Netflix, we are gravitating to video, and video has a necessary place in healthcare. So the digital front door is a much broader strategy. It includes personalization and tailoring across that patient journey.
Okay. And so, Nancy, I know when we spoke the other day, you said you weren't necessarily looking for the kinds of things that Mytonomy did for the digital front door, but your eyes open wide when you two met. So tell me how you see that fitting into the digital experience that you've already been developing.
So, good question. I'm not sure we knew the term digital front door when we first started, but we've been busy with telehealth, particularly extending care into our rural settings for quite a while now. So we started with telepsych, and we found that both our providers and our patients really enjoyed that. Telestroke, so that we can actually have neurologists from the emergency department in Roanoke extending care throughout the rural space. We're getting ready to do more telehealth in the pediatric area, so children don't have to come into the more urban setting, and pulmonary and developmental and neurology, and also extending fetal monitoring and genetic counseling through telehealth. So that was sort of the first, or the second foray, I would say. So stepping back, we were an early adopter of the electronic health record, and we created a patient portal. So patients have access to their own record and can also communicate with their provider through that portal. But we began to see this as a more strategic tool so that we could make ourselves available wherever, whenever patients wanted to access information. And when I first met Anjali, she started talking about Mytonomy, and I was like, that's it. That's what we're missing. It's a short form video, 3 minutes at a time, available anytime, anywhere, agnostic to device, that patients could access, that could really supplement the work that we were doing to help our patients gain control. And we think longer term to improve health outcomes. Now I have to tell you, she didn't tell me about this wine tasting thing until afterwards, so I might have jumped on that too. But right. We're really very excited about Mytonomy. We think that it's accelerating our digital front door. It's been a catalyst for change for our organization. One thing we really like about it is that we can customize it, and our physicians, our nurses, we can brand it so that the trusted source, sort of the loyalty that we've created with our patients, with the consumers in our region, look to us for their care, and they look to us for this information. So I'll just tell you quickly that we're starting with orthopedic procedures, okay. But also because of the patient population that we care for the most, we're going to use videos and Mytonomy training for chronic illnesses like hypertension, hyperlipidemia, the opioid crisis, and for diabetic training.
Yeah, and I can appreciate that. One of the things that I thought was cool was, the quick lessons, rather than watching a 45-minute video and not finishing and feeling like a failure, you're working toward something. The other thing I liked too was, and I can appreciate with the orthopedics, not everybody's physical therapy is the same depending on what I've done to my knee or my ankle. And
even if most health systems will provide educational programs for diabetics, for new diabetics, for ongoing education, for someone who's going to have a knee replacement or a hip replacement or a shoulder replacement. There's going to be what we call a joint academy where you go and you learn. It's in person. We're going to continue to do those things, but that's at our convenience, right? So it's at a time when we're going to be there providing that information. Well, what about the patient that can't come then? What about the patient that wants to get started early, wants to share that information with their family and with their friends? So this way, they can have information anytime, anywhere, on any device, maybe when they get off at work at 11 p.m., like some people do, and can start their physical therapy watching the video right then. And they can watch one and watch it again, or sort of graduate in a serial format to another video.
Yeah. And I think that's what makes Mytonomy really unique within Digital Front Door. We're bringing video into healthcare in a novel way. We're bringing high production quality short form video into healthcare, along with the content that your doctor wants you to watch, along with what the health system wants to give you, and we're tailoring that so that the content at Karelian is slightly different and unique than the content at Duke or Columbia or Rush or Hackensack Meridian Health. So you're getting a personalized and tailored experience from your healthcare system in short form content for mobile streaming on any device, anywhere, across the entire continuum, whether you're coming in for diabetes checkups or whether you're getting ready for surgery or you're going home after surgery. And that's very unique. And what we're finding is that patients watch a lot of content. They'll watch 40 to 42 minutes of content in the system. That's how we measure ourselves. We look to see initially what's the usage, right?
And I would, whenever I hear about a new platform, I think, well, how are the clinicians going to react? Because it's all about workflow. And it doesn't seem like this would really interrupt. If anything, maybe better, because the patients are coming in hopefully better prepared physically and mentally.
I think this strategy works best if your clinicians are involved up front, as ours are, sure. And they embrace the change. And it does help the patient relationship with the provider because they're more informed, they're engaged. Your actual time with the provider may be shortened, and they're asking wiser questions. They're not asking the same question over and over because they've got that information. When we started thinking about the digital front door, we tried to understand more about consumers and what this whole strategy might mean. And I think we've organized this in 3 pillars. And one might be accessibility. So by that I mean on-demand, transparent, easy to use. The other is instructive. So we're actually giving information that a patient or a consumer needs, that they want to use. And then lastly, it sounds a little corny, but it's motivational. So how can the patient actually do something with this information? And I think that's where you get back to the provider relationship, where this supports and is very much augmenting that relationship with having an engaged patient. And of course, our providers really like that they're getting high quality, sophisticated information, and it's the same thing every single time, so we can be assured of that. And we know that a more engaged patient, a better informed patient, actually has better health outcomes.
Yeah. Something's telling me we're out of time. I don't know, maybe it's a sixth sense. But I hope it was informative for you all. I enjoyed it. Thank you very much.
Thank you.